Hey everyone, today we'll discuss about the whole root of the fifth cranial nerve, that is the trigeminal nerve. So first of all, these are the whole root, the branches of the trigeminal nerve. I know it's a bit difficult to remember all these things, so I'll make it a bit easier for you by showing some characters so you can relate with those characters and you can remember the whole root and the branches of the fifth cranial nerve. So first of all, the basic thing is that this nerve originates from the pons and it is a mixed nerve. What is mixed nerve? That is, it has motor part as well as the sensory part. So now, first of all, this motor nerve relies on the trigeminal ganglion, and then it gives, very importantly, three branches. Which three branches? The ophthalmic, maxillary, and the mandibular branch, right? And then about the sensory part. So this sensory part enters the foramen ovale. It passes through the foramen ovale, and along with this also the third part of the trigeminal nerve, that is the mandibular part, also passes through the foramen ovale. Okay, so this was the basic thing. Now we'll discuss about each and every nerve over here, each and every branch over here. So first of all, the ophthalmic branch. Now consider the ophthalmic branch as Tom. Okay, so what happens is, first of all, this ophthalmic branch and the maxillary branch both passes through the cavernous sinus. Okay, now what happens is, after passing through the cavernous sinus, first of all we'll discuss in detail about the ophthalmic. Okay, so focus on the Tom only right now. We'll discuss about the Jerry later. First of all, the Tom. The ophthalmic nerve passes first of all through the cavernous sinus, and then after passing through the cavernous sinus, it gives three branches, that is the frontal, nasociliary, and the lacrimal branch. Okay, these three branches. Now after giving these three branches passes through the superior orbital fissure. This frontal branch, after passing through the superior orbital fissures, gives further two branches, that is the supratrochlear branch and the supraorbital branch. Okay, simple. What shall I tell now? Ophthalmic branch first of all passes through the cavernous sinus, then gives three branches, that is the frontal, nasociliary, and the lacrimal. Then these three branches passes through the superior orbital fissure. So first of all, frontal branch gives further branch, that is the supratrochlear and the supraorbital. Now next is the nasociliary branch. Now this nasociliary branch first of all relies on the ciliary ganglion, very important. And after relying on the ciliary ganglion, it gives these four branches, that is the anterior ethmoidal, posterior ethmoidal, long ciliary, and the infratrochlear branch. These four branches. Now what happens is, about the anterior ethmoidal branch, this one. Now this anterior ethmoidal branch enters to the anterior cranial fossa, and after entering to the anterior cranial fossa, it reaches the lateral wall of nose, or we can say it enters the nasal cavity, and in the nasal cavity it reaches the lateral wall of the nasal cavity, right? After reaching over there, it pierces the wall and gives a branch, that is the external nasal branch, that too where? At the nose tip. First again, anterior ethmoidal branch enters the anterior cranial fossa, then it reaches the lateral wall of the nasal cavity, and then it pierces there and gives a branch known as the external nasal branch at the tip of the nose. Okay, now next is the lacrimal branch. Simple. Lacrimal branch enters the lacrimal gland. Simple. It innervates the lacrimal gland. Now we'll discuss about the Jerry, that is the maxillary branch of trigeminal nerve. Same way, it passes through the cavernous sinus and then it enters the foramen rotundum. Now after passing through the foramen rotundum, this maxillary branch relies on the pterygopalatine ganglion. It relies onto the pterygopalatine ganglion along with the greater petrosal nerve. Greater petrosal nerve is a branch of facial nerve, the seventh cranial nerve. Remember this. So this branch of seventh cranial nerve also relies on the pterygopalatine ganglion, and this maxillary branch also relies on this particular ganglion, right? Now after relying on the pterygopalatine ganglion, this mandibular nerves gives a branch, that is a zygomaticofacial branch. Zygomaticofacial branch is a branch of trigeminal nerve, maxillary branch only. And also it further goes and gives posterior superior alveolar nerve. Very important. Posterior superior alveolar nerve. Now after giving all these branches, it enters the inferior orbital fissure and then gives first of all the infraorbital nerve, anterior superior alveolar nerve, middle superior alveolar nerve, and also zygomaticotemporal branch, which then innervates the lacrimal gland. So we have over two zygomatic branches, that is zygomaticofacial and the zygomaticotemporal branch of trigeminal nerve. So again, what happens is maxillary nerve, what happens first of all passes through the cavernous sinus, then enters the foramen rotundum. Over there, it relays on the pterygopalatine ganglion along with the greater petrosal nerve, which is a branch of 7th cranial nerve. Now, this trigeminal nerve this maxillary nerve over here gives a zygomaticofacial branch and further continues and give posterior superior alveolar nerve and then enters the inferior orbital fissure, where it gives infraorbital nerve, anterior superior alveolar nerve and the middle superior alveolar nerve, along with zygomaticotemporal branch, which supplies the lacrimal gland. So this was all about the ophthalmic and the maxillary branch. Yes, it was that simple. Now we'll discuss about the third branch, that is the mandibular branch of trigeminal nerve. Now this both mandibular branch and the sensory branch, if you remember, were passing through the foramen ovale, right? I showed you in the very first slide that they were passing through the foramen ovale. So simply they will pass the foramen ovale. Now what happens to the sensory branch after that? Then it enters the foramen spinosum. What about the mandibular branch? So after passing through the foramen ovale, it relays first of all onto the otic ganglion, very important. And then it gives very important two branches. Which two branches? That is the just consider this river as the mandibular branch only. Okay, over here it was mandibular branch relaying onto the otic ganglion, and then it divides into two branches further, that is the anterior branch. A is anterior and P is posterior branch. Now first of all, the anterior branch supplies the muscles of mastication. Which muscles? Which nerves over here? Nerve to lateral pterygoid, supplying the lateral pterygoid muscle, deep temporal nerve supplying the temporalis muscle, and the mesenteric nerve supplying the masseter muscle. Simple. Over here, some fibers from the sensory nerve also comes and gives a buccal nerve. Buccal nerve over here is a sensory nerve. Now what does this sensory buccal branch do? It pierces the buccinator muscle but don't supply it. Okay. So these three are the motor. Just remember that these three are the motor branch supplying the muscles of mastication, while this is a sensory branch which just pierces the buccinator muscle. That's it. Now what about the posterior? Now this posterior branch further gives auriculotemporal nerve, lingual nerve and the inferior alveolar nerve, which further gives nerve to mylohyoid and the anterior belly of digastric nerve. Now remember one thing, that the anterior part over here, the anterior branch is mainly motor, while the posterior branch over here is mainly sensory. So auriculotemporal nerve, lingual nerve as well as the inferior alveolar nerve, these are mainly sensory nerves. Now some details over here about the posterior branch. Now what happens is, first of all, the auriculotemporal nerve. Now this is not a straight nerve. What happens is, this nerve makes somewhat a pin-shaped structure over here. Okay, this makes somewhat a pin-shaped structure over here, this auriculotemporal ATN, auriculotemporal nerve, right? Now this auriculotemporal nerve supplies a gland, a salivary gland, which is the parotid gland. Okay, simple. Now through this pin-shaped structure of the auriculotemporal nerve, an artery passes. Which is that artery? That artery is middle meningeal artery. Through this pin, an artery passes, that is the middle meningeal artery. Now the clinical importance of this artery is, it is that artery which is damaged during the extradural hemorrhage. Okay. Now we discussed previously that through this particular foramen spinosum, this sensory nerve passes. right? So what happens is this middle meningeal artery is also passing through this foramen spinosum. Through this particular foramen spinosum, sensory nerve as well as the particular middle meningeal artery passes. Just remember this, okay? Now next is the lingual nerve. Now this lingual nerve, first of all, it relays onto a ganglion which is the submandibular ganglion. So just remember, previously we discussed about this parotid gland. This is a gland, right? This is a gland. While this lingual nerve relays onto a submandibular ganglion and then it supplies the anterior two-third of the tongue. Anterior two-third of the tongue. Now next is the inferior alveolar nerve, which gives two branches, that is the nerve to mylohyoid and the anterior belly of digastric. Simple. Now I will really appreciate you if you were thinking about this, that if this nerve is supplying, this anterior part of this mandibular nerve is supplying the lateral pterygoid, then which nerve is supplying the medial pterygoid? So we discussed previously that this mandibular nerve, after passing through the foramen ovale, it relays its fibers to the otic ganglion, right? Now from this otic ganglion, this particular nerve gives a branch, nerve to medial pterygoid. It gives a branch, that is the nerve to medial pterygoid, right? And also it gives further two branches, that is for tensor tympani and tensor veli palatini. This was some extra points. So what happens is the mandibular nerve relays onto the otic ganglion, and from the otic ganglion it gives the nerve to medial pterygoid branch along with two further branches, that is the tensor tympani and the tensor veli palatini nerve branches. So this was all about the fifth cranial nerve root. If I wanted, I would have explained you this whole topic through these pictures and it would be very easy for me, right? But I want you to remember everything with fun and with ease, so you can remember it till the end and you even enjoy the process of learning. So I hope you found this video helpful. Thank you so much.